Hello, I'm Margaret Whoriskey and I'm responsible for the Technology-Enabled Care programme at the Scottish Government. Thank you very much for the invitation to speak to your conference today. In Scotland, we published our first digital health and care strategy in 2018. It's very much focused on a person-centred vision, and it set out a number of key priorities to be delivered over the next few years. The Technology-Enabled Care programme focuses on empowering individuals by supporting spread and adoption at scale of technology-enabled care, service redesign and service change. It's a multi-cross-sector programme of work which has a range of programme portfolios, and I'll touch on a few of those in a few minutes. So, what was our response to COVID? We already had a programme of work underway, but we recognised that there was a need to have a review and relook at our priorities. So I'm going to cover these in three different areas. The first is programmes of work that we require to rapidly scale up. And examples there are our video consulting programme Near Me and our digital mental health programme. The second area is where we had to refocus and expand existing programmes. And again, I'm going to focus a little bit on our remote health pathways work and our telecare programme. And finally, new programmes of work that emerged that previously hadn't been part of our plan. For example, a focus on care homes, digital inclusion, which is our Connecting Scotland programme, programmes such as Test and Protect, and our proximity app. And again, I know many countries have been looking at similar developments over a very short period. So to say a little bit more about some of those, our video consulting programme had been underway in Scotland for a few years. We had some interested pilots, small scale projects, but we had an aim that we would scale up this over the next 2 to 3 years. So in March, we had approximately 300 consultations happening every week. By June, that went up to 17,000. And we're now seeing about 18,500, 19,000 video consulting calls a week. So that was a very rapid scale up in a very short period of time. Our programme for government, which was launched by our First Minister, really sets out that Near Me, which is our video consulting programme, should be default, assuming that's appropriate for the person and also is suitable for the clinician or professional undertaking it. So a very clear commitment that we should be integrating video consulting as part of business as usual. With regards to digital mental health services, we had some work already underway and we built on this and then rapidly scaled up further our computerized cognitive behavioral therapy programs and internet cognitive behaviour therapy, again covering all our health boards in Scotland and referral rates increasing week on week. One of the areas where we looked at expansion was our remote monitoring. So we had a programme of work underway which was focusing on hypertension scale up, but with COVID we looked to see should we be doing anything differently. So we rapidly procured a new solution and developed a tele-COVID monitoring pathway to be able to provide supported self-management to people who have a diagnosis of COVID, may have some risks of deterioration, but that their symptoms can be picked up through remote monitoring much quicker, so they don't present as an emergency to hospital, often too late or requiring very significant intervention. And we're also working with a range of other programs to look at conditions such as COPD, we're looking at heart failure, we're looking at preoperative care, again to see can we provide alternatives to people to be able to get the right intervention, the right support, but through remote pathways. Our telecare service is a service that's available to approximately 180,000 vulnerable adults in Scotland. It's working very closely with our social care colleagues, and it provides people with an alarm or other sensors in their own home which they can activate or you can collect information on to be able to receive some support. So again, with COVID, we looked at turning some of our reactive capability into proactive calling. So a number of areas began to do proactive well-being calls to people on telecare devices. So we could provide advice, signpost them to services, or pick up if there was concern about maybe somebody deteriorating at home. So I'm now going to come to the area that I said was new areas of work that we hadn't previously been doing very much on. And the example I'm going to use here are care homes. So again, in Scotland, similar to other countries, very significant challenges for our care homes and our residents. So we developed with a range of stakeholders across the sector a digital approaches care home action plan, which set out a number of priorities. So we have digital foundations, which is focusing on digital connectivity in care homes. We've got digital services. So what are the range of services, including video consulting, that could support residents to access services? And digital leadership and skills, again, very key underpinning the need to support the workforce. So on digital foundations, we secured £1 million to provide some digital devices to care homes that can help residents connect both to families and social, connect them socially, but also to be able to connect them to well-being, support, health and care services. And with digital services, we're working on video consulting, as I said, but also a clinical assessment tool that can help staff in the care home assess somebody whose condition may be deteriorating or where, you know, they can get an early diagnosis of COVID and again, an intervention. And on the third area, we're working with our workforce organisations to provide some skills and support. So the emerging priorities really are to continue the COVID resilience and mobilisation in recovery and looking at that new landscape of health, housing and care. The second is about identifying and expanding opportunities in key programmes for national scale-up and adoption. We've shown that we can do it during COVID, so we can certainly look at where we can look at further scale-up and adoption. Really important that we build on experience to date in the UK and with international colleagues. The third area, which has come into really sharp focus, is digital inclusion. In Scotland, with a population of just over 5.5 million, it's estimated that about 800,000 people are not effectively included from a digital perspective. They maybe don't have the right device, they don't have the money to pay for data, or they don't have the skills. So we've got a big programme of work underway, which is looking at how we can support people to be digitally included. The fourth area is citizen engagement. The real importance of involving citizens in co-design and co-development of our solutions. Again, with COVID, we'd done some preparatory work beforehand, so we're able to roll out some programs that had good citizen engagement. But clearly, it's important that we continue to invest in that, spend the time to do that well, so we have sustainable, person-centred services going forward. In Scotland, we've got an independent review of adult social care underway. So again, we're looking to ensure that we can position digital as a key enabler to support that. And we're also seeing the importance of young people. We've had a very good collaboration with a national organisation called Young Scot. They're about to publish a report on their work with us. And they've set out a number of key priorities from a young person's perspective that we want to build on and work on going forward. So that's a very quick review of work underway in Scotland, our response to COVID and the direction of travel going forward. So I wish you well with your conference and thank you very much again for the invitation.